The following is a community affairs presentation from the Ulster County Health Department. This is the Healthy Ulster Radio Show, a weekly presentation exploring community health and sustainability with guests representing a broad spectrum of community partners working to make Ulster County the healthiest in New York State. This program is sponsored by the Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network.
Good morning and welcome to another edition of Healthy Ulster Radio. I'm your host, Dr. Carol Smith, Ulster County Commissioner of Health and Mental Health. Joining me today is my co-host, Vin Martello, Director of Community Health Relations. Good morning, Vin.
Good morning, Dr. Smith. Our listeners know that we talk with guests and experts from a wide array of organizations and professions that influence the health, vitality, and sustainability of our community. And today, we'll be talking about what we and our community partners are doing to prevent smoking and tobacco use, the number one cause of preventable death and disease in the nation. Smoking-related diseases cause over 9,000 Americans to die prematurely each and every week. Dr. Smith, before we introduce our guests, tell our listeners what some of the smoking-related diseases are and why smoking and tobacco use is so dangerous to one's health.
There's no question, Vin, smoking is a killer. Cigarette smoking causes more than 480,000 deaths every year in the United States. That's about 500,000 deaths a year. And although the adult smoking rate in New York State has come down, there are still approximately 2 million adult New Yorkers who still smoke, and about 73,000 New York State high school students who currently smoke. So smoking affects every part of the body. Certainly, cancer in almost every part of the body can be linked to cigarette smoking. Not just lung cancer, but cancer of the esophagus, of the larynx, of the kidneys, of the colon and rectum, of the bladder, of various kinds of blood cancers are related to smoking, of the cervix. So not just lung cancer is involved with smoking. If you have asthma, tobacco smoke can trigger an attack and make the attack worse. Smokers are 12 to 13 times more likely to die of what's called chronic obstructive pulmonary disease, COPD, or emphysema. In addition, heart disease is linked to smoking. For coronary heart disease, smoking causes about a 2 to 4 times increased risk of coronary heart disease, 2 to 4 times greater risk for stroke. It is also linked to diseases of the pancreas and of the stomach, preterm early deliveries, stillbirths, low birth weight babies, sudden infant death syndrome in babies, ectopic pregnancy. So just about every aspect of the body, every system in the body is adversely affected by smoking.
Yeah, pretty much bad news. The only product that, when used as directed, will either cause you to become seriously ill or perhaps kill you, or more likely to kill you.
There's no question.
Well, on that note, we at the Health Department and throughout Ulster County with our partners focus very much on prevention. And so today's guest is Ellen Reinhardt, who's Director of Tobacco-Free Action Communities in Ulster, Dutchess, and Sullivan. We've worked with Ellen over many years on a number of important tobacco prevention initiatives. Ellen is a esteemed community partner who has worked tirelessly to prevent and discourage tobacco use among youth and adults, and to counter the relentless onslaught of tobacco company marketing directed at adults and kids. Good morning, Ellen. How are you?
Good morning, both of you, Dr. Smith and Vin Martello. After that wonderful introduction, I should just leave right now because that was fabulous. Thank you so much, and thank you so much for having me here today.
Thank you for being here and for all that you do to help this cause. We certainly appreciate it in Ulster County.
Oh, thank you. I really love this work because you really see the needle moving forward, and you see the smoking rates going down, and you see the kids not picking up that first cigarette. It's such really, really wonderful work, and I'm so blessed to have this position. So thank you.
So Ellen, what exactly is TFAC? What is its mission? How did it come to be? And Who are some of the what are some of the organizations? What are some of the organizations that?
Well, TFAC, which everybody calls us TFAC, it stands for Tobacco Free Action Communities, and now we used to be just in Ulster County, but now we are in Dutchess and Sullivan as well. We're a program of Health Alliance of the Hudson Valley, and we're one of 25 Advancing Tobacco-Free Communities grants that are funded throughout the state by the New York State Department of Health Bureau of Tobacco Control. We consist of two components now. In our new grant that started a couple of years ago, we have now a youth component. So we have a youth component for the first time in years. It's branded Reality Check. And we also have a community engagement component. And that is our work that we're out in the community educating on tobacco prevention, and the hazards of smoking, as well as tobacco marketing and that sort of thing. Our goals are to decrease youth tobacco use, to motivate adult smokers to quit, and to eliminate exposure to secondhand smoke. Our main focus really is establishing policies that protect our communities and make the Upper Hudson Valley a healthier place to live, work, and play. There are a few important policy initiatives that we work on to help meet those goals, and they're broken out into four main ones. The first one is tobacco-free outdoors. No one should be walking through a cloud of smoke when they enter a building. And when you go to a park or a playground, you shouldn't be hit with secondhand smoke or cigarette butt litter. And it really is a health concern, secondhand smoke. It's not just an annoyance, it is a concern, because the U.S. Surgeon General came out and stated that there is no safe level of exposure to secondhand smoke, both inside and outside. So our work is to work with municipalities to try to assist them in developing a tobacco-free outdoor policies for their parks, playgrounds, and around their buildings, as well as businesses. We work with businesses, local businesses, to help them in developing this policy for their employees and for their customers. We also supply free signage for both, so we really want to be there in support and to help with that. Another initiative is our smoke-free multi-unit housing initiative. We get calls from tenants a lot saying, what can I do? What can I do about the secondhand smoke that's coming into my apartment? I don't smoke, and now my neighbor downstairs or my neighbor next to me is smoking, and it's coming into my apartment, and it's affecting my health, it's affecting my child's health. So we work with landlords and managers and tenants on educating them on the importance of a tobacco-free policy for multi-unit dwellings or apartments. There's been many that have developed across the state in the last several years, and I know now HUD has recently come out and said that, I believe it's 2017, that all HUD housing will be tobacco-free. So we really want to help educate on why it's important to have a smoke-free place to live as well. We also have a tobacco point-of-sale marketing initiative, and that's to address the tobacco marketing and promotions in stores, and you see in convenience stores or in pharmacies, because in grocery stores, because that is a cause of youth smoking. That display of tobacco behind the counter really is, a U.S. Surgeon General has stated, it is a cause of youth smoking. And our smoke-free media, that is really a reality check arm solely. It really, Reality Check focuses on this, and it's to promote policies to reduce the tobacco use imagery in youth-rated movies and on the internet, because and in all forms of media, because it's important to not have our youth bombarded with images of people smoking, because they think it's normal and they think it's acceptable. So that is kind of our four initiatives in a nutshell. As far as partners, a very important partner for us is the Ulster County Department of Health. We really appreciate working with you, and you have been fabulous in getting the message out, in helping us to coordinate our message, and so you're valuable, so valuable to us, and we really appreciate it. We also have the Ulster County Prevention Council. They have been a wonderful partner for us as well. And in Dutchess County, we have CAPE, Council on Addiction Prevention Education. They have also been a wonderful partner. We also are a part of many community organizations, boards. We try to just reach out and work with people in what they find important, and also to help us move our needle forward as well.
Mm-hmm. I know you mentioned smoke-free parks and playgrounds, and you and I wore out a lot of shoe leather going out there.
Yeah, we sure did.
Talking under the fabulous leadership of our county executive, Mike Hine, we really worked to, first Ulster County itself prohibited smoking on all county property, but then we went out and talked to a lot of municipal leaders and communities out there about getting them to adopt local regulations that would prohibit the use of tobacco products in their parks and playgrounds.
Right.
That's just one of the significant accomplishments. Can you give us a few others that you're particularly proud of that you could highlight for
Well,
us?
sure. The first is back in 2003 with the passage of the Clean Indoor Air Act. That was an amazing step forward in protecting workers from secondhand smoke, and especially in restaurants and bars. So all workers in every work site are now protected from secondhand smoke. And as you mentioned, 100% smoke-free policy for Ulster County, which was really fabulous when that was passed, because Ulster County then became a leader. That was in 2008, I believe. But it really became a leader in New York State. It was one of the first counties to pass such a law. And our law here included SUNY Ulster, which a college campus, fabulous, and also the county fairgrounds, which again, great. We used to get a lot of calls from fairgoers saying, what can we do about the smoking? And so that really helped, again, move the needle forward in Ulster County. Not only that, but the county park as well is a smoke-free environment. So Ulster County really, back in 2008, 2009, started their leadership role in New York and has kept on going, because we've also worked, like Vin said, with all the county municipalities. I think most of them are now have a tobacco-free policy for outside, for parks, playgrounds, around their entryways, which is terrific. Recently, the e-cigarette have been added to the Ulster property law, that there's no smoking on Ulster County property. Now there's no e-cigarette use as well. That's both inside buildings and outside buildings. That's another wonderful step forward. We've also partnered with the Department of Health, on your community health improvement plan, making sure that tobacco was a huge part of that plan, because that, again, it's the number one cause of preventable death, so it makes so much sense. So we really appreciate the county health department really taking that bull by the horns and helping us move forward. And of course, the most recent local law that prohibits any new tobacco retail licenses being issued within 1,000 feet of K through 12 schools. A huge, huge step in the right direction in helping kids never pick up that first cigarette.
Right. I mean, that's really where stemming the onslaught of tobacco marketing comes into play. And we know that, that communities that have a higher density of tobacco retailers in proximity to schools have higher rates of youth smoking. So
that's correct.
It's
The U.S.
really,
Surgeon General
really
came out with
measure.
that in his report, in their report, and stated that along with the secondhand smoke part, it also was that kids have a high rate of smoking when they have tobacco sold in their schools.
And also, you mentioned e-cigarettes, and I think that's a very important point, because the cigarette manufacturers have basically used that as a tool to have individuals who perhaps hadn't smoked, or lead them to think that maybe this is a way to stop smoking, have started advertising in very much the same ways that they advertise cigarettes over the past few decades. And they're certainly going after the youth and trying to get them to start with e-cigarettes, which then become basically a stepping stone to going on to cigarette smoking, because the e-cigarette is a nicotine delivery system, and of course nicotine is the highly addictive agent in cigarette smoke.
Right, and on the e-cigarette, e-cigarettes are the new frontier, like you said. They're being able to be advertised on TV and in magazines where the cigarette is no longer, allowed on billboards or on TV. And they also talk about vaping. It's vaping, it's vapor, it's
cool, it's hip.
Yeah, it's not, it's harmless, but there's no, it's not vapor, it's aerosol. And so it contains toxins. So when the e-cigarette user inhales, draws in that aerosol, it when the secondhand aerosol comes out, it contains toxins and pollutants. So they're finding it's not safe. And what's really great is the fact that it hasn't been regulated up to this point. But the FDA has come out and they're starting to do some regulation with e-cigarettes. They've now been deemed a tobacco product, meaning now that you can't sell an e-cigarette to anyone under 18. You have to report the ingredients because no one knows what's really in them. So now they're going to have to report the ingredients in an e-cigarette, and it's also not an FDA-approved quit aid. So it's not a cessation aid. Some people say it's really helping them to quit smoking, and great. If that's what gets you through, then fine. But don't use it around others. Use it, help yourself in your own space, but you don't want to emit the vapor and the aerosol vapor to others.
Well, let's pick up on that subject again after this brief break. We're here with Ellen Reinhardt, Director of TFAC, and Dr. Carol Smith. We'll be back after this.
The excitement continues to build. The mission of Health Alliance is now made even stronger by our new partnership with the Westchester Medical Center Health Network. By combining a legacy of community-based care with WMC Health, we are building a stronger, healthier, and more vibrant community. We'll be collaborating to provide preventive, primary, specialty, and advanced care right here where you live, where we all live. Health Alliance and WMC Health, advancing care here. Visit HAHV.org to learn more.
If you just tuned in, you're listening to Healthy Ulster Radio. Today's discussion is about tobacco use and tobacco marketing and what we and our community partners are doing to prevent it. Our guest is Ellen Reinhardt, Director of TFAC, Tobacco-Free Action Communities in Ulster, Dutchess, and Sullivan. Hello again, Ellen. We were talking about e-cigarettes before the break, and just curious. So, how does e-cigarette use and vaping relate to youth smoking rates, and how that may be transitioning over to e-cigarettes?
Well, the use of e-cigarettes by kids is rising rapidly. I just read a report that 3 times the amount of middle school and 4 times the amount of high school students are smoking e-cigs in the last year alone than the previous year. So now, as Dr. Smith just said before the break, it is becoming a gateway to smoking regular cigarettes. The youth smoking rate in New York is at an all-time low of 8.8%, and e-cigarette use is at 21.7%. And you've got dual users, and you've also got that nicotine element. Nicotine is the addictive quality of cigarettes. So now they're becoming addicted to nicotine and will begin to use regular cigarettes. So we really, it's a little bit of a scary thing because kids think it's safe. Kids think it's fun. They wear them around their neck. The problem with e-cigarettes is they do not come under any clean indoor air law restrictions. You can use them in schools if schools haven't adopted a policy to include e-cigarettes, like the County of Ulster did in their properties policy. They aren't covered under clean indoor air at all. So you could sit at your desk in any environment and use an e-cigarette, and unless that company, that school, that business, that restaurant has developed a policy saying no e-cigarette usage in my building, in my business, in my restaurant. So we really need to look at this and understand this, that the regulations need to really, like FDA is starting to regulate them, they're really important. So.
And certainly we can advocate for the development of these policies and laws and regulations, just as Ulster County was among the first to start that regulation in its properties. Up in Albany, certainly, and federally, we can start lobbying on behalf of including those e-cigarettes under the Clean Indoor Air Act, and so that we can support legislation to curb the use of the e-cigarettes and really basically protect the health of our youth.
Right. My role in the community is to educate on all of these things, and I know that American Lung and American Cancer and departments of health are taking a step further, and hopefully something that step further will help in helping to not let that child decide that e-cigs are safe and I'm going to use them.
Mm-hmm. Ellen, both with our new local law on tobacco licensing and prohibiting new licenses within 1,000 feet of all K through 12 schools, and some of your initiatives that are really targeted, focused on marketing. Why is marketing a big area of focus for you? Why is it so important?
Well, tobacco companies spend over $9 billion a year, more than $24 million a day, and over $500,000 a day in New York alone, to market its products in stores where kids are likely to shop. And so we've talked about the Surgeon General, so we know from the research, the U.S. Surgeon General said that tobacco marketing in stores is a cause of youth smoking. From the posters and signs you see outside and inside the stores, to those bright-colored walls of tobacco you see behind the checkout counter, the tobacco industry spends over 90% of that $9 billion on that marketing because they know it's their most effective tool. Tobacco marketing in stores is a cause of youth smoking. They also know that 90% of all smokers began smoking before the age of 18. And in New York, the average age of a new smoker is 13 years old. So no matter what the tobacco industry says or does, they know that they can't stay in business unless kids smoke. And so they know that those bright-colored packages and those bright-colored signs make kids notice them. We don't, as non-smokers, they're like wallpaper to us, but they notice them. And it is the cause of their smoking, one of the causes.
Well, those of us who followed the congressional hearings where the tobacco CEOs came in and talked about we don't market our products to kids, were totally contradicted by their own documents in the tobacco settlement cases where the state's attorney generals went in and sued the tobacco companies and went in going through the documents where they talked about over and over again about recruiting new smokers, because when you think about it, their customers are literally dying from using their products, so they have to get new replacement smokers. And vaping itself, e-cigarette use, is really just, in many respects, a marketing mechanism to get people on board
addiction,
that deadly train.
Correct. And tobacco use, people call it a habit. It's not a habit. It's a very powerful addiction, and it is a gateway. It's a gateway to other addictions. It's also, once the tobacco industry knows that, they know how to hook people hard and long. And I want to say, everybody out there, that if you are a smoker and you want to quit, don't get discouraged if you quit and start again. It takes probably 5 to 7 times of quit attempts to really do it for good for a lot of people. So keep it up, keep trying, because it's expensive. And like you said, Vin, before, tobacco is one of the only products, when used as directed, will kill half of its users.
Mm-hmm. I'm a certified trainer for Freedom from Smoking, which is American Lung Association cessation program. It's considered to be the gold standard. And one of the things they talk about is that the most difficult thing to do, it's the physical addiction of smoking goes away in a couple of weeks, but it's really the mental addiction to it. And really, that the people who are successful at stopping are the people who decide that, yes, this is going to be incredibly difficult and incredibly challenging, but I'm going to do whatever it takes to stop, because I know the consequences of not doing that for myself and my family are catastrophic.
Right.
Really.
Right. We have a new media campaign that we launched on World No Tobacco Day, which was on May 31st, and it's called Seen Enough Tobacco. It's a campaign to continue on the education of New Yorkers about the dangers of tobacco, the industry marketing in the point of sale, the retail environment, and what the effect of that has on our youth. And it's a cause, Surgeon General came out and said it's a cause of youth smoking. And so if anybody is interested in becoming a supporter or becoming, just voicing their feelings about, or opinions about tobacco use, they can go to seenenoughttobacco.org, and on there you can sign a petition, an online petition. Also on there you can go to Twitter. You can share the information on Twitter, on Facebook, and through email. So it's a great opportunity for you to help educate our education piece, for you to help educate your friends and the community on tobacco and the different things that tobacco marketing, the impact it has on our kids.
And on a local level, how's the general level of support among the public for these tobacco prevention initiatives, whether it's the the law that prohibits the issuance of new licenses around schools or other initiatives. Have you conducted local surveys in the area to gauge public opinion and support for these types of things?
We've conducted surveys for the last 10 years, and we use a professional polling company, so we don't do them personally, but we hire a professional polling company to do them. And over the last 10 years, the level of support for our work and for limiting exposure to tobacco is huge. For example, I think it was 78% of all Ulster County residents support having no retailers 1,000 feet of schools. So yes, we have great support for this.
And as a physician, I want to say that I certainly would encourage our listeners to talk to their doctors and healthcare providers about quitting, getting medications that might be right to help you quit. The New York State Smokers Quit line is free. It's in English and Spanish, 1-866-NY-QUITS, where you'll get some direct assistance in helping, either through a live counselor and or patches, et cetera, to help you quit smoking. So please take advantage of those resources.
And before we close out the program, Ellen, so where do you see things headed? Are you optimistic about stopping tobacco use?
Sure, I'm very optimistic because from our work and the many successes that we've had in New York over the last 15 years, like the Clean Indoor Air Law, more and more tobacco-free outdoor policies, smoke-free apartments, tobacco marketing restrictions, we're helping to reduce that smoking rate. Adult smoking rate in New York is at an all-time low of 14%, even lower than the national rate of 15%. And the current youth smoking rate has been declining as well. It's down to another all-time low of 8.8%. So it's great news, but there's much more work to be done because we want those numbers to be zero. Zero adult smoking rate, zero youth smoking rate. One of the greatest actions we can take to protect and improve the health of our communities is to end tobacco use, and we can work together doing that. So thank you.
Thank you for all that you do, Ellen. You're really terrific to work with, and it's always great, and it's for a really good cause to reduce unnecessary illness and suffering and premature death caused by tobacco use. Today's guest, Ellen Reinhardt, Director of TFAC, Tobacco Free Action Communities in Ulster, Duchess and Sullivan. We loved having you here today. We hope you can come back again soon.
Absolutely, anytime.
My co-host, Dr. Carol Smith, our wonderful Commissioner of Health and Mental Health, who offers so much support to us and engaging the community. That's all the time we have for today's program. If you'd like to contact us for more information, please send an email message to healthyulsterradio@gmail.com, and you'll get any information that you need on helping to keep your family, yourself, and your community healthy and strong. We'd be happy to help you. See you next week.
You've been listening to the Healthy Ulster Radio Show, a community affairs presentation from the Ulster County Health Department, sponsored by Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network. Thanks for listening, and be sure to join us for another edition of the Healthy Ulster Radio Show next week.